Are you thinking about knee replacement surgery? Or maybe you are waiting for your operation or already recovering from it. You probably have questions. How will I feel after surgery? When can I walk again? How long will recovery take? In this video, I'm going to guide you through exactly what to expect after knee replacement surgery, step by step, so you feel prepared and confident for every stage of your recovery. Knee replacement surgery is a procedure where the damaged surfaces of your knee joint are removed and replaced with an artificial implant. It's usually done to relieve severe pain from arthritis or injury and to restore mobility. There are two main types: total knee replacement, which replaces the entire joint, and partial knee replacement, which replaces only the damaged part. Today, we will focus on total knee replacement surgery, and I will walk you through everything you can expect during your recovery process. Recovery starts immediately after surgery, and most people notice improvements over the first 12 weeks, although it can take 6 months to a year to regain full strength. A physical therapist plays a key role in helping you stand, walk, and perform exercises safely. Your recovery plan will depend on your age, health, and your surgeon's protocol. But understanding what happens day by day can help you feel more confident and in control. Many people are anxious about knee replacement surgery because they don't know what recovery will look like. They worry about pain, swelling, or losing independence during rehab. Without a clear plan, it's easy to either overdo activity and risk complications, or move too little and slow down recovery. Confusion about timelines, when to walk, drive, or return to work can make the process stressful. That's why knowing exactly what to expect stage by stage is so important. Hey, I'm Jan Sosnowski, a physiotherapist working in Dubai, and I help people recover from knee surgery safely and effectively. I've worked with patients who were worried they would never walk normally again, or that everyday tasks would remain painful. By following a structured rehab plan, they regained strength, mobility, and independence. Imagine being able to walk confidently without pain, go up and down stairs safely, return to hobbies like walking, cycling, or dancing, regain independence in daily activities, feel in control of your recovery and health. This is possible, and now I will show you what to expect during the 12 weeks after total knee replacement surgery and how to set goals of your healing. Day 1. Right after surgery. Rehabilitation begins as soon as you wake up. A physical therapist will help you stand, sit at the side of bed, and take a few steps using a walker, crutches, or cane. Some people have the surgery as an outpatient procedure and go home the same day, while others stay in the hospital for a short recovery period. Your physiotherapist will teach you how to move safely, get in and out of bed, and use a bedside commode if needed. You may start gentle exercises to keep your knee moving and prevent stiffness. Pain, swelling, and bruising are normal, but controlled movement helps your recovery. During the first 48 hours after surgery, it's important to focus on achieving full knee extension as well as bending the knee by following your surgeon's recommendations. First week. Your main focus is on gentle exercises and mobility. You will work on walking, basing knee bending, and strengthening your muscles. Your physiotherapist will guide you on safe ways to use an exercise bike or do short walks. You will also learn how to manage pain with medication, ice, or leg elevation. Showering may be allowed depending on your dressing type. Your medical team will guide you. The goal is to gradually increase movement while keeping your knee safe and pain manageable. By week 3, you may be walking with a cane or no assistive device at all. You can usually stand and walk for more than 10 minutes. Daily activities like showering, dressing, and light housework become easier. Prescription pain medication may no longer be necessary. Exercises continue to improve your range of motion and strength. Remember to alternate between sitting and walking to prevent stiffness. Weeks 4 to 6. Your knee should feel stronger and more flexible. Swelling usually goes down. You may begin longer walks and start returning to work if your job is mostly sitting. Driving may be possible with your doctor's approval, especially if you are off narcotics. Your physiotherapist may introduce exercises like toe and heel raises, hip abductions, and light functional tasks. You are regaining independence and can do more daily activities like cooking and cleaning. Week 7 to 11. Physical therapy continues, focusing on building strength, mobility, and endurance. Exercises may include mini squats, step-ups, leg balances, and stationary cycling. Low-impact activities like swimming, walking, or cycling can be added gradually. You should notice significant improvement in flexibility, strength, and confidence in your knee. Consistency with exercises is crucial to regain normal movement and avoid setbacks. Week 12 and beyond. By week 12, most people can enjoy activities like golf, dancing, or cycling. Your knee should have much less pain and range of motion is often nearly full. High-impact activities like running, basketball, or skiing should still be avoided unless cleared by your doctor. Recovery continues over the following months with ongoing strength and mobility improvement. Long-term exercises like walking and stationary cycling help maintain knee function and durability. Avoid excessive stairs, kneeling, or squatting. Now it's your turn. Follow your rehab plan and be consistent with your exercises. Every small step helps you regain strength, mobility, and independence. If you want more tips, exercises, and guidance for knee replacement recovery, subscribe to my channel and turn on notifications. Share your experience in the comments and let me know what stage of recovery you are in. Together, we can help you move safely and confidently again.